Kettering Health has a long history of being very innovative in the field of medical imaging and technology in general. Kettering Health was the first institution in the city to have CT scanning. They were the first to have MRI, and they were the first to bring in PET scanning, or positron emission tomography, and that was largely on the influence of my predecessor, Dr. Joseph Mantle.
In 1987-88, we learned about PET technology and able to convince Mrs. Kettering and the Dean of the Medical School and the hospital administration to bring PET scan to Kettering Hospital. And once the PET center got established, we were able to expand that into doing lots of brain tumor work, lots of schizophrenia work, and we're able to establish a cardiac PET center.
So cardiac PET was a key and integral part of PET imaging. Cardiac PET provides many major advantages in terms of cardiac perfusion.
And we are also finding that we can get better information from the studies that we obtain, particularly as it relates to myocardial blood flow patterns and flow reserves.
So you can imagine that this was a very unique situation for a community hospital to be sitting with this revolutionary technology some 30 years before it became really clinically implemented. We could never become a full-blown academic site, but what we could do is in this particular avenue, this particular space, we would try to match what academic sites would match when they turned the research PET into clinical PET. And so when you looked out and saw what the academic sites were doing, everybody was looking at PSMA imaging.
PET imaging has allowed us, particularly PSMA PET imaging, because it's linked to a molecule that's expressed on the prostate cancer itself, allows us to identify and detect this cancer earlier in the course of disease, and again allow us to be more pinpoint and focal and precise in how we come together with the treatment plan.
The important thing having a cyclotron in the department was the fact that we could get FTG anytime we wanted. And once that happened, then we were able to make things like fluorodopa, carbon-11 methionine. So we were able to do methionine imaging of brain tumors.
It's been invaluable as a surgeon that Kettering has been working with methionine for such a long time. It's incredibly unique outside of nearly any center, to be able to provide this level of imaging. Having methionine here allows us to get a greater extent of resection on the tumor that we wouldn't be able to otherwise, and so we can offer a better resection for our patients here.
So another opportunity that we're just looking at more recently is called MR-guided neuroablation. And in that instance, we use real MR guidance, so we put the patient in an MR scanner and we align the patient to their imaging. And then the neurosurgeon can put in a very fine wired laser, and they can then track that laser in real time in 3D, move the laser around inside the tumor, and then they heat it up and literally melt the tumor from the inside out. This allows them then to kill the brain tumor without damaging any of the overlying structure.
While we do have state-of-the-art equipment here in our department with digital PET scanners, a cyclotron, excellent imaging and therapy facilities, it would not be possible if not for our administration's support, the leadership of our medical staff, and our terrific imaging staff.
At Kettering Health, collaboration across disciplines is absolutely essential to the treatment of all the cancers we take care of here. There's no patient who comes through our Kettering Health Cancer Program who is not afforded that full collaboration. No decision, no therapeutic decision for our cancer patients is made by one person. And in doing that, that allows us to have a standard and really optimized treatment approach for each patient who comes to see us.
So with nuclear medicine, the big breakthrough has been molecular imaging that has taken off, but side by side and as a result of molecular imaging, Theranostics has taken off. And Theranostics, as a lot of people know, is sort of a combination of the words therapy and diagnostics, because now the therapy is completely guided by the diagnostic imaging we do from the molecular imaging side. So with that foundation being laid, We provide radionuclide-based therapies, which we've been doing in nuclear medicine for well over half a century, but now it's become much more sophisticated. We want to do research, which would be an academic style research, but the research isn't for the purpose of research alone. The research will be something that we feel is going to be directly beneficial to our patients and community. The partnerships that we build will be in line with that.
For us, we're on to our second cyclotron, we're on to our second rebuild of our radiochemistry lab. We're looking at our third purchase of a digital PET CT scanner. This technology is not too big for a community site. We can prove that, and we have. And so I think that's our mission, at least our personal mission, is that we can be a template for the growth of this technology throughout the United States.